Everyone, welcome to Ka Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank universe for giving us this great opportunity. And Dr. Sweta Singh, our Ka Chief Administrator, will start the session.
So, hello everyone, myself Dr. Shweta Singh, Ka Chief Administrator, welcomes our respected speakers, Chairman and CEO Kavita Ma'am, Ka volunteers, and all the attendees to Ka webinar. I would like to take the opportunity to introduce Ka Homeopathy Study Group to all of you. Ka Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kuknu, President and CEO of Kavita Holistic Approach, Ka. This study group is intended to be an offering from Kavita to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model are foundational principles for the Ka. Ka's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification, CSC, and Echina CPD provider, and serves as the associate editor for the Homeopathic Heritage. She is the recipient of Martha Allman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Tana Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA, Mr. Harbhajan Singh Cheema, Ex-Director Homeopathy, Government of Uttarakhand, and Chairman of HomeoCure and Research Institute during homeopathic seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Dr. Deepak Sharma, Ka Executive, Dr. Rajneesh Kumar Sharma, Ka Advisor, and Dr. Shweta Singh, myself, Ka Administrator. Ka team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, USA. Dr. Kavita was also honored by renowned DTA, Detroit Telugu Association Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. We are extremely happy and proud that we celebrated 12 years of her book Beyond the Limits, A Challenge to Prove Oneself, and her second book, A Dose of Spirituality, has also completed 2 years. The ebook was launched last year in presence of Honorable Guest of Speakers, American Institute of Homeopathy, AIH President Dr. L.S. Becker, and Council for Homeopathy, CHC President Dr. Sheetal Tiwari at our Ka webinar. At Ka's second annual celebration, our Honorable Guest of Speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1,500 to 10 to 15 charities, which we have also listed on the website with the name Kavita Kuknur. Dr. Kavita donated the proceedings of the book through Ka Study Group platform to various charitable organizations and homeopathic associations. To name a few, are Kevin Friendly Foundation, CHC, DHMA, GSPS College, VT Seva, NCH, etc. Interested ones can reach us for details at carstudygroup@gmail.com. As of now, we have nearly 420 recordings of professional webinars related to homeopathy, health-related topics, and inspirational talks available on our YouTube channel, Kavita Kukunur. This webinar is moderated by Ka family, myself, and Dr. Niharika Sabra, Ka volunteer. It is being recorded as we speak, and we will take questions at the end of the webinar. We will post a jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive your certificate. Kindly mute yourself and turn your video off for better connections. Now, before starting the scientific session, I would like to invite Dr. Deepika Balani to read Code of Ethics.
Good evening, ma'am.
Dr. Deepika, are you there? Yeah.
Yes, ma'am. Good evening. Am I audible?
I'm sharing. Yes, yeah, you are.
Sure. CAR Homeopathy Study Group Pro Bono, Ethics and Benefits. To be a CAR speaker needs at least 1 to 2 months of active volunteering. Only CAR speakers' theme are promoted in newsletters and webinars. CAR provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to the WhatsApp group. Articles of volunteers will be posted on CAR website and newsletter and will be sent for publication at other journals too. Volunteers and speakers are eligible for prestigious CAR annual awards. Volunteers are also eligible for CAR inspirational talks. Volunteers are eligible for case discussions. CAR promotes homeopathy study organizations as well as their mega events. CAR promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. CAR maintains a healthy and happy environment, so keeps only like-minded folks. CAR also requests everyone to maintain the confidentiality of the group. You may also visit our website www.kavitahomeo.com. Thank you.
Thank you, Dr. Deepika. And now let me introduce our honorable speakers to all of you. Today we have with us Dr. Vinayak Rathod, who is MD Homeopathy, who has been practicing scientific classical homeopathy at Yavatmal district in Maharashtra for more than 2 decades. Founder of Observational Homeopathy, now in India, he is among the best brains in the field of homeopathy. He's a keen observer and applies simple scientific logic in homeopathy with amazing success in many severe pathological cases. In his cured cases, he had shown that there is a role of homeopathic medicine in severe, grave pathological conditions like coma, SOL, cancer, gangrene, GB syndrome, etc. I'm confident that presenting his scientific cured cases at this webinar would contribute to the broader clinical and academic discourse in the field of homeopathy. He's a recipient of prestigious Lokmat Excellence in Healthcare Homeopathy 2023. He'll be speaking on the topic homeopathy in deep terminal pathological cases. Welcome, Dr. Vinayak Rathod, to CAR platform.
Thank you. Thank you, ma'am.
Yeah. And you may please proceed with your session.
Thank you. Thank you so much. First of all, good evening good evening and good morning to all my doctors, those who are listening me right now, those who are listening from out of countries, out of India, and those who are listening from in India. Before to start this webinar, really, first of all, I would like to appreciate you and thank you to the Holistic Approach, Holistic Group. Especially thanks to Dr. Deepa ma'am and Dr. Kavita ma'am for providing this international platform to me. Really thanks. And after listening from Dr. Shita Singh ma'am, really it's so many work, huge work is going on under the KHA. So really, again, I would like to appreciate you, Dr. Kavita ma'am, for doing the best of best for all the homeopaths to uplifting the knowledge of the homeopathy and upgrading this science. So, again, I would like to say one thing that along with this group, there are so many doctors are attached. Dr. Vinita Roy, Dr. And I'm not getting the names right now. But really, I would like to thank all the core teams of the KHA group. Thank you so much for inviting me for this webinar.
Thank you so much.
Right now,
I'm pleased to
thank
have
you.
you. Yeah.
Thank you. Thank you so much, ma'am. So I'm going to start my speech and webinars.
Yes, please.
So before to start my webinar, so I would like to emphasize on this special observational homeopathy. What is the exactly observational homeopathy is right now? So homeopathy is a system of medicine that developed in the late 18th century by our father and founder of homeopathy, Dr. Samuel Hahnemann. It's founded on the principles of like cure like. This means that a substance that causes symptoms in the healthy person, when highly diluted, treat similar symptoms in a sick person. Over the centuries, practitioners and researchers have made numerous observations about its efficacy, mechanisms, and the patient responses. The idea in the aphorism number 6 that the unprejudiced observer needs only note what is felt by the patient and that perceived by those around the patient and observed by the homeopath diminishes the subjectivity of all participants in all particular homeopathic observer. So again, I would like to emphasize on historical context and foundation of the observation. What is observation homeopathy? So already Dr. Samuel Hahnemann, in his initial observation in the late 70s, led to the led to the development of homeopathy. He noted that substances causing the symptom in healthy individuals, when diluted and succeeded, could alleviate the similar symptoms in the ill. Hahnemann's work, especially his publication, The Organon of Medicine in the Healing Art, that documented his systematic approach to the treatment, including detailed observation on the preparation and administration of the remedies. He introduces the concept of proving, where healthy volunteers would take the substances and record their symptoms, whether it is physical or mental, forming the basic for the remedy selection. So, what is unprejudiced observer? By unprejudiced, Hahnemann means to desist from theorization, relying only on what is perceptible to the senses. He enumerates subjective symptoms, objective symptoms, and the incidental symptoms that are observed by the patient or by the observer as the only representative of the diseases. So one should be an unprejudiced observer while observing the case. In clinical observation, the individualization of treatment. In homeopathy, we all emphasize individualized treatment. Practitioner observe that even patient with the same diagnosis may receive the different remedies based on these unique symptoms and overall constitution. This personalized approach is a hallmark of homeopathic practice. In my clinical practice since 2 decades, I have given immense importance to this concept of observation, and I found it is very effective and useful in the treating any minor condition or any deep pathological condition, any irreversible conditions of the diseases. There may be different kinds of cancers, SOL, lung malignancies, uterine malignancies, breast malignancies, rectal malignancies, even in the comatose, in the hopeless cases, gangrenes and GB syndrome. I found that along with this observational homeopathy, one must have the right knowledge of diseases, right knowledge of repertory, and our homeopathic materia medica. And one can very easily prescribe the correct similimum in a very short span of time and can develop the much confidence with the homeopathic prescription. So what is to be observed in any case? So physician has to just observe the patient and just listen to the patient very carefully. He or she doesn't have to ask much to the patient. Many things in the observation are non-verbal, like gesture, the way he or she is communicating with the physician. The most important thing is his or her behavior with the attendants. Observing the patient from top to bottom. How he or she is entering in the chamber, how he is approaching you, how he is looking towards you, his build, his look, his face, her neck, her hairlines, her forehead, nose, ears, teeth, texture of hairs, texture of the skin, her way of answering to the physician, her way of sitting posture, her way of clothing style. All these observations are going to help us in decoding the similimum. From my experiences, all I can say is that physician have to listen. Physician have to literally listen through your his or her heart, not just through your ears. So this is all about the observational homeopathy, what to observe, what not to observe. So along with this, I would like to present my deep pathological case in front of you. The case of brain hemorrhage with metabolic encephalopathy. See, right now, I told all these things about the myself, that along with the observation, I am doing the practice in Maharashtra and getting the very astonishing results in any minor and major cases. So I love to present, I love to share my experience. So I'm not came here to teach you, all my dear doctors. I know that all the doctors are doing the well in their practice. But it's a platform that has been provided by Dr. Kavita ma'am. So I would like to share my experiences in front of you, that you can also take the very astonishing results in any pathological, deep pathological, in any hopeless cases, any critical cases. So just only one case I'm presenting in front of you, my dear doctors. So the case of brain hemorrhage with the metabolic encephalopathy. The case is.
हे बॅग जवळ कुठे भरली तरी आता कुठे जाता लग्न केली आताच चालू काही इकडला इथले तरी एसीचे रिमोट कुठे नाही आहे इथे रिमोटच नाही इकडे नाही एसीचे रिमोट
So this is the case. Patient is hospitalized in the ICU since near about 15 days. but still he was not getting any recovery, any improvement. So all the relatives of that patient came in my chamber with all the reports, and because it was unable to come patient in my chamber, the patient's relatives came along with all the reports, all the CT scans, MRIs, and blood reports. Along with, I asked them for to come along with all the videos of the patient. So I have to observe the patient before to prescribe my medicine. They came along with the videos and reports. So my dear doctors, you should have to observe in this case. This is the very deep pathological case, brain hemorrhage with encephalopathy, cerebral encephalopathy. So in this case also we can get the dramatical results with the homeopathic science. So details of the patient. So Mr. ABC, age was 49 years old. The chief complaint, what I observed, not giving answer properly, irritable while answering, complaining for dyspnea, complaining for dysuria, complete anorexia. Physical and mental general patient was chilly, very irritable person, dictatorial personality, having the amorous disposition, using the abusive languages. Patient is very loquacious. Along with patient is timid and fearful. So there was history of head injury. This history has been given by the patient's relative only. So my dear doctors, so only observe this case and come with your conclusion. We can discuss the medicine along with the selection. So do your work on observation of this patient. So after 10 days of our medicine of single dose of homeopathic medicine, patient is getting the recovery. And see the recovery of this patient after only 10 days.
हात दाखव वर वर पासा
Patient got discharged from the hospital, from ICU, and patient came into his house and is taking diet
पाय हलव
at
दोन्ही
his home right now, doing his doing his some activities of the games.
हात हलव दोन्ही
So this miraculous result has been given by the single dose of homeopathic medicine, only on the observation basis. Second follow-up after 1 month after medicine.
चल
See the results of the patient. How the homeopathy can give the result in any deep, pathological, irreversible, critical case. Homeopathy is a great science, but you should have to knowledge back of your mind,
कुठून दाखव उभा होऊन
knowledge
वर
about
करून
the
समोर
homeopathy,
पकडा गेलाय
knowledge
पाय
about the oregano, knowledge of Matramentica, knowledge of
बस
repertory.
सांग आता काय होते
वाकडे
हं, हं,
जे 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 पाहिजे
हं,
फ्रीनेस ते नाही अजून त्यांच्याशी मुक्ती बांधायची
हं.
तशी. कंप्लीट झालं नाही हे घे बस सर्व
कसलं हात दुखणं वगैरे
हो.
हं.
ते हाताचं फ्रीनेस काहीच नाही
बरं. ओके
कंप्लीट राहिलं
गावठी पाऊस वाटतोय गड्या
नाही. तेवढं राहील
झालं ओके
So this is the result given by only the single dose of homeopathy. Chatbox कुठे आहे? हात न लावता चालून पाहण्याचा प्रयत्न करत जा थोडसा. चला बरं. चला बरं. हात न लावता चालून पाहण्याचा प्रयत्न करत जा थोडसा. So in the chat box, so many doctors has prescribed the medicine after the watching of this video. Dr. Deepa ma'am, Elaborus has been prescribed. Dr. Mukund Gajbir, Lycopodium. Answer slow, incoherent. Okay. Madhvi, Rajesh, Hi Samus, DD Netramure. Okay. So results after 2 months. हात न लावता चालून पाहण्याचा प्रयत्न करत जा थोडसा. चला बरं.
फक्त स्वतःला भीती वाटते
अच्छा भीती वाटते. चला बरं. हात न लावता चालून पाहण्याचा प्रयत्न करत जा थोडसा. चला बरं.
फक्त स्वतःला भीती वाटते
अच्छा भीती वाटते. चला. So final prescription with the potency selection. Considering upon the case, pathology, symptom similarity, and the remedy prescribed was potency selected. 30C single dose was prescribed from my side. There are no repetition was given from my side, and only on the single dose of homeopathy, single dose of one remedy, we can get the marvelous results. So, what medicine has been prescribed from my side, I will disclose at the ending. Zincum metallicum in the, I'm observing the medicine has been came Zincum metallicum, Nux vomica, okay, Lyco, Elaborus. So my dear doctors, all are taking the good efforts from your side. Thank you. Thank you for participating. So what I observed in this case, I took only two rubrics from this observation. Shamelessness, one, and second rubric was taken from my side, wrinkled forehead. Only two rubric has been chosen. Now after taking these two rubrics, I got only few medicines. Lycopodium that Mukund Gazbi has been already wrote down in the chat box. That Lycopodium, someone has been write down about the Dr. Deepika Vedani is wrote down about the Nux So Lycopodium, Nux Stramonium, Hyoscyamus, Phosphorus, Veratrum album, Elaborus. Good. Elaborus has been wrote down by Dr. Deepa. Okay. Core and Natrium. Okay. So I like to rule out all this medicine. Wrinkled face. Elaborus. Dr. Arvind Yadav, Stramonium. Okay. So I like to rule out all these medicines in front of you. So Lycopodium. So we just go briefly about the Lycopodium. So what is Lycopodium? Lycopodium is sometimes called the vegetable sulfur. Thousands of years ago, the Lycopodium clavatum was actually a huge tree which over by years reduces to small form called as a club moss. The main feeling in the Lycopodium is that the person remains small. His survival will be difficult. He will be humiliated. He will be nowhere. The main theme of Lycopodium therefore becomes ambitious, desire to grow bigger, being a more powerful, reaching the higher position. Lycopodium is a part of Calcarea, Lycopodium and sulfur cycle. In this cycle, Calcarea represent the stability, security, house, family, good health, protection. Because Calcarea belongs to the fourth row of the periodic table. Sulfur represents name, fame, ego, image, to be recognized, the need to be proud of oneself. This is sulfur. Lycopodium can be dictatorial, dogmatic, may be ambitious, but Lycopodium people have a big fear, which is the fear of taking the new challenges or facing the new situation and meeting the new people. Lycopodium has a lack of confidence. He feels he is incapable, thus feels anticipatory anxiety. So we can differentiate from Cilicia. This may appear like a Cilicia, but the difference is that in Cilicia he is capable of doing the task. Rather, it is that his image should be protected at all costs. So Cilicia is afraid to go on the stage. Lycopodium is an emaciated person, having the stoop shoulder, emaciated neck. We can consider he is a intellectually keen but physically weak. Don't want to play, want to be sit on the one place, want to play the video games, I want to be on the computer. But he is very sensitive. Even cries when thanked. Very sensitive. Timidity and cowards are the main symptom of the lycopodium. Fear of being alone. He always needs the company. Along with that, he don't want to take any responsibility. Next one is Nux vomica. Nux vomica. Nux vomica is a medicine which belongs to the Loganaceae family. Shock is so sudden that it can paralyze the person. Sudden shock of being disappointed, being let down. Elements from the bad news, insults, humiliation, and anger. This is the indication of the Loganacea family. Shattered, shock, and paralyzed. Patient is very irritable. We can say as a sanguine temperament. So Nux vomica is a person who gets his things by hook or by crook. He's a very industrious person, passionate person, very fastidious. He's a hard taskmaster, very chilly. He's a jealousy. Jealousy is also one of the part of Nux vomica. Lachesis, Nux vomica, lachesis, apis, hyoscyamus are the most jealous remedies in our Matremedica. Abuse is also one of the indication of the Nux vomica. Desire for stimulant like alcohol, smoking. This is all about the Nux vomica. Another medicines are also comes under the Loganacea family, that is Ignatia, Spigelia, Cuirer. This belongs to the Loganacea family. Next one is the Stramonium. All the medicines are, I'm going to rule out all this medicine in front of you. This is a Stramonium, we call it as a Dhatura. Stramonium belongs to the Solanaceae family. The fright, terror, shock, panic, horror, darkness. This is the main symptom of the Stramonium. Main symptom of the Solanaceae family. It is a sudden, intense, violent terror, paralyzed by the fear. Stramonium patient feels helpless, like a child left alone. He feels abandoned, forsaken, left alone in the terrified place, alone in the wilderness. Child always awakes to the terrified, knows no one, screams, clings to those near, clinging to the person and clinging to the furniture. There is strong fear of darkness, always desire for the light. Darkness produces a very scary situation for him. Feeling of delusion of being injured, anger along. In anger, there is a destructiveness of the clothes, tearing the clothes like a parcel. When he stressed, he reacts wildly. Wildness, destructiveness, violence, striking, along with the religious affection. This all an indication about the Stramonium. It may near close to the Veratrum album. Veratrum album belongs to the Liliflora family. Next one is phosphorus. Phosphorus belongs to the mineral kingdom, belongs to the third row. Main characters of phosphorus. The communication. Concepts of communication is very applicable for the phosphorus. They want to talk and exchange ideas. Sympathy. They are very sympathetic person because they are having the tubercular miasm. Due to often open communication, phosphorus is very sympathetic. Friends and neighbors, they have many friends. Consider someone to be a friend, even when they have only just met them. The classical picture of phosphorus is that the patient whom you feel you know well after the first consultation that you would like him to be your friend. Lean, thin, fair, attractive, desire to travel, curious, very polite, smiling face, sharp face. This is indication of phosphorus. Next one is Veratrum album. So Veratrum album belongs to the Liliflora family. Feeling of disgrace, feeling of neglected, left out feeling, excluded, ignored feeling is the main indication of the Liliflora family. The main feeling of Veratrum album is that he has lost his social position, which he must regain quickly by anyhow, otherwise he will be finished. Gambling, fraud businesses, the fear of being attacked, threat of being alone in the wilderness, threat of being deserted by his partner. He's a very egoistic person. Bharata Balbam is a very egoistic personality. He feels like he's a king. Along with that, he's very religious. Sure. Similarly, in his speech, he's a very extravagant and his ability to lie without any hesitation. His pleasant fantasies and there is a delusion of communication with the God. This is all belongs to the Veratrum album. Desire for ice, desire for cold thing, desire for salt. The special indication of the Veratrum album is only there is a sweat only on the forehead. This is also one of the indications of the Veratrum album. Next one is Elaborus. Elaborus also, someone has been selected. I think Dr. Deepa has selected Elaborus. Elaborus medicine. Elaborus belongs to the Ranunculaceae family. There is elements from indignation, humiliation, being hurt. There is a silent grief, secret anger, rage, head injury. This all belongs to the Ranunculaceae family. Aconite, Elaborus, Pulsatilla, Stapes, Semisifuga. These all belongs to the Ranunculaceae family. There is hydrocephalus and meningitis. In Elaborus, there is automatic motion of one arm and one leg. Unconscious, stupid. Answer slowly when questioned. Chewing motion of the mouth is also one of the observational point in the Elaborus patient. Along with that, there is a boring of head in the pillow, rolling of head from side to side. This also we can see in the apis mellifica also, rolling of head from side to side. But in apis, there is only meningitis. In Elaborus, there is hydrocephalus. Constantly picking his lips. This is we can consider as a gesture of the patient. Constantly picking his lips, his clothes, boring his nose with his finger, tremendous dullness. This is indication of the Elaborus. Last but not the least, this is the Hyoscyamus. Hyoscyamus belongs to Solanaceae family. As we consider, there are Belladonna, Stamonium, Hyoscyamus. Everything goes under the Solanaceae family. It's a very irritable person, sanguine temperament, his wrinkled forehead. The main feeling of Hyoscyamus is that being suddenly let down, disappointed, betrayed, especially on whom he is completely dependent. Very loquacious, gesturing, higher sexuality, as a amorous disposition. There is shamelessness, and on the other hand, threatening, like violence, striking, and desire to kill. Fear of being poisoned is also one of the indication of Hyoscyamus. Very suspicious. Elements from fright and panic. Diseases with increased cerebral activity. Patient desire to escape, desire to run. This is also indication of the Hyoscyamus. So this is all about the medicines. So someone has selected natrum falls, Again, Hilaburus. Okay. So after considering all the symptoms, totality of symptoms, personality, wrinkled face, completely shamelessness, without having any hesitation, with irritability on the face, I have given the medicine to this patient, Hyoscyamus 30. Only Hyoscyamus 30 was single dose was prescribed in the ICU, and he was getting the recovery within a few days. Within I think near about 72 hours, 2 or 3 days after prescribing the Hyoscyamus, he was getting the changes. And after 10 days of our medicine, patient came to his home. So this was the miraculous results given by the only single dose of our medicines. So considering upon the case pathology, symptom similarity, the remedy was prescribed. Hyoscyamus 30 single dose. There was no repetition was given. So my observation, wrinkle on face, shamelessness. So in conclusion, observation in homeopathy encompasses a broad range of clinical experiences, patient response, scientific investigation, and contemporary trends. While the practice remains continuous within the scientific community, its persistency, popularity, and anecdotal success underscore the need of continued research and open-minded exploration. As homeopathy evolves, integrating rigorous scientific method with traditional observation insight may help illustrate its role in the modern healthcare. Thank you so much for listening me. And again, I would like to thanks Dr. Kavita ma'am for providing this international platform for me. And thank you for my core team, Dr. Ravi Hirani, Dr. Prabhakar Zaibai, Dr. Sheetal Tongse. And thank you so much for the again team of KHA, team of Dr. Deepa ma'am, Dr. Shweta Singh. Thank you so much for calling me over here on this platform. Thank you. Thank you so much.
Nice presentation, sir. Very nice presentation.
Thank you.
Yeah.
Thank you, madam. Thank you so much.
Thank you, sir, for the presentation. It was
Thank
really
you so
very insightful. I guess Dr. Shweta ma'am has joined. Thank you so much, sir, for such an enlightening session. And we will take the questions at the end of this, the next session for which will be taken by our second speaker, Dr. Deepa Rajenimbalkar, who is associated with us as CA volunteer. She is BHMS, MD in Pediatrics, PhD from Homeopathy University, Jaipur, practicing at Lifetron Healthcare Homeopathy Clinic, branch head and senior doctor at Positive Homeopathy Clinic at Indranagar, Bangalore from 2009 to 2011. Practiced at DRDO Scientist Hostel Homeopathy Clinic, Bangalore. She has over 18 years of experience of homeopathy, specialist for the treatments of infants, toddlers, children, and teenage groups. Author of book Panchakosha, Homeopathy is Divine Science, and many peer-reviewed articles. She provided personalized, modern, and transparent homeopathic treatment on the principles of classical homeopathy. Her practice is supported by clinical research-based data, statistics, and scientific documentation. Dr. Deepa has a distinction of having treated eminent patients from various faculties such as scientists, IT professionals, doctors, professors, government officers, spiritual gurus. She has conducted school health checkup and distributed preventive medication at the time of chikungunya epidemic and COVID pandemics, presented seminars on homeopathic management of pediatric cases at national and international platform, received award from Star Time Media Most Promising Homeopathic Clinic in 2019, received Young Researcher Award in 2021 and 23 from Institute of Scholars, recognized as a reviewer of international publishing platforms. She'll be speaking on effectiveness of homeopathy in speech in autism. So welcome, Dr. Deepa, at KHA
Yes,
platform,
yes.
and you may now proceed with your session.
Thank you, Shweta. Thanks a lot for such a wonderful conducting session since so long. Since I joined KA, you are there. Thanks a lot to Kavita ma'am also. And today's presenter, first speaker, Dr. Vinayak Rathod sir, I think he shared one case, but the thought process, what he gave was really wonderful. I remember a quote: give a man and you feed him for a day. Teach a man to fish and you feed him for a lifetime. So, sir, your presentation was like taught us. Many times it happened, we select a good rubric, we will come to the remedies, but differentiation of remedies is very important. That comes after observation and after experience. And Dr. Vinayak sir has shared his gratitude and thanks to everyone. That is so nice of you, remembering each and everyone, each and every doctor, sir. We will somehow, we are meeting on Zoom, but soon we meet sir in person. How the time permits, we will see sir.
Yeah,
Yes, and
definitely.
yes. Thanks to Dr. Ravi Hirani and Dr. Jyoti Hirani. They referred your name, sir, and it was so nice of Dr. Kavita ma'am. And she gave opportunity for me also. You, Dr. Deepa, you also join as a speaker. So we both are here. Very nice, sir. Process what you shared. I really remembered my days when I used to work with Dr. Amarsiya Nikam, sir.
Okay.
At his hospital. Yes, yes. The way of his teaching and your teaching matches. Yeah.
Thank you so much. Thank you so much.
Yeah. Very nice. GHF also, so you presented the same GHF case. GHF, you presented the same.
Yes,
Global
same case.
homeopathy.
No.
Same.
No.
That was different case.
That was different case.
Okay, sir.
No, actually, I have represented so many deep pathological cases in Dubai, at the international seminar was there
Okay.
in January 2024. There are so many cases have been presented over there. So many comatose case, deep pathology cases, Guillain-Barré cases, malignancies cases has been presented over there.
Okay, sir. Nice, sir. Nice.
Thank
All the best wishes. Yes.
Thank you, ma'am. Thank you.
So, yes. So, dear doctors, welcome. Myself, Dr. Deepa, a volunteer to homeopathy, KA volunteer as well. So, I am presenting effectiveness of homeopathy in speech in autism. So, usually, what happens? Many patients are coming to me. They want their children should talk. They are coming with a proper diagnosis, and they say, "Ma'am, our child should talk." So, we will see. Countries with highest rates of autism among children worldwide are estimated 222 per 10,000 children in the United States. And it includes, the spectrum denotes the range of symptoms as well as their severity. Symptoms can include difficulties with speech, social communication and interaction, repetitive behavior, sensory issues, and hypersensitivity to stimuli. So directly I will come to the case. Everyone is interested in the case, I know. So you can see this form. This is written by patient mother, Rishi, the name of a patient. And he has a, this is completely written by patient. Even you can see 5 years, 4 months. He has a speech delay and is hyperactive. He has a short attention span and does not respond to commands he does not like. He does his activities in his own likes to follow a strict timetable and takes some time to adjust to any new activity. He speaks in 2 or 3 words, not in complete sentence. He is undergoing speech therapy and OT therapy. He likes to play with blocks and arrange things, likes to color, like rhymes, cooking with me. At the age of 2 years, he got febrile convulsions. So this was a history the patient has. But still, we are having our procedure. So complete history was taken on communication, social skill, attention, these things. Past history, history of lactose intolerance, soya milk advice by a doctor, pediatrician, history of a speech therapy since 1 year without any improvement. Family history, father, mother, both are healthy. Appetite increased, every time wants biscuits, especially sweet, craving aloo fry and sweets, aversion, nothing specific, food aggravation, sweets, disturb the stomach causing dyspepsia. Though he likes sweets, but that disturb. Thirst, water intake 8 to 10 glasses per day. Sweat after more playing. Sleep, laughs in sleep, grinding of teeth. Thermals, hot. Motion, worms reported sometimes back, at present not sure. Urine clear, dreams, nothing. Restlessness while complete case taking, jumping on examination table, anger throws the things, pushes the other person. Always one helper is required. Mother is not able to handle it. When complete case taking was going on, he was literally jumping on the table, on the examination table. Father staying at
Sorry, Dr. Deepa, sorry to interrupt you. Your slides are not visible.
Slides are not visible.
Yes.
Okay.
Can you please reshare?
Now it is there, ma'am.
No.
Okay. Since beginning, it was not.
No, it's not visible since beginning.
Okay. Now it is there, doctor.
No.
Now.
Can you please stop sharing and again reshare?
Okay. I am able to see it.
But it's not visible at our side.
Okay. See, one video is also there, doctor.
Your video is there.
Okay. Now it is there, Dr. Shweta.
No, ma'am.
No. Okay. I have to do share screening.
Yes, share screen, then select your slide. Yes.
Yes.
Yeah, but your screen is visible, but not that your PPT.
Right.
Yes,
Now it is there.
yes,
It is there, Dr. Shweta.
yes, yes, yes,
Besides mind restlessness.
yes.
Okay. So I was talking about Dr. Rishi case. Okay, it's coming right now, Dr. Shweta.
Yeah, it's
Visible?
perfectly fine. Yes, please
Yeah,
go
yeah,
ahead.
yeah. So
Yeah.
just coming back, sorry for these technical issues that nowadays I'm facing. So this was the form written by the patient's mom. What I showed you, everything like I have read for you. So just we will go forward. So mind, yeah. These are the rubrics what we have selected for the this patient. For Rishi. Yes, and the medicine was given was Sina 400, Sina 200, four pills. Single dose consists of four pills. I usually give the medicine in the form of pills. And on 29 July, after showing flashcard, he is telling two words, clear two words. Physical generals better. During PTM, first time teachers gave good feedback. Usually they want that he should speak, ma'am. The thing should, parents wants more improvement on sentences. So he was not able, as mother herself mentioned in the form you can see. This is the form written by the mom. Speech delay and hyperactivity, not able to speak. So considering we have given him Sina, and with a single dose, he was able to the slowly the improvement happened. Vital force is nothing but the placebo. Parents wants more improvement. Vital force 200 was given. Every follow-up is given date-wise. And on 23/9/2019, they went to Alibag to meet his father. To August month, they have not visited the clinic. I'm just sharing you the experience, how the clinical, the OPD basis will happen. He is pushing his cousin, sister, not able to understand. She will get hurt. Physical general is better. So at this time, seeing this, we have given tuberculinum 1M. The case started with Sina 200, 7 July, and it was maintaining on placebo only. But on seeing his behavior, intercurrent tuberculinum 1M was given. So November, on 2nd November 2019, reported fever, taken allopathic medicine at Alibag, again fever after taking the K. So first episode of fever happened at Alibag. So at that time, they have taken an allopathic medicine. Again, they came to Bangalore, came back to Bangalore. There he had a K. So after taking the cake, he had a fever. So again, we have given arsenic album 200, 3 doses advised. At that, this time we have not given any allopathic medicine. So 13th November 2019, improvement in speech, social mingling is good, IQ good, eye contact improved, tuberculinum 1M single dose again given. And on 13 Jan 2020, the patient is telling, madam, give the same medicine, whatever you are given is improving a lot. She is telling about the Sina, the first medicine. Madam, give that medicine because these episodes in between happened for him. But still, at this time, I gave only Vital Force 200, that is a placebo. 17th February 2020, talking full sentences, telling names, I want dance, participating in activities. Currently, mother is at Hyderabad along with Rishi and father is at Alibag. They wanted the medicine, but due to lockdown, medicines is not sent. This I'm talking, this is a 2020 and he is doing good. So mother is sharing So this is the video. The you can see. He's telling 5 sense organs. My name is Rishi. Eyes, nose, ears, touch, skin to touch. Thank you. So this is the Rishi. The mother came. The complete case was given by mom. The mom's observation. We have given the medicine, and I have shared you how the clinical experience happened. They are children in between the acute episodes keep happening. So that also I tried to share. And mother was so happy with this. A boy is talking confidently in a school. After this, he got a prize in dancing as well. Very happy. The boy who is not able to speak, he is holding mic and he is telling about 5 sense organ. My name is Rishi. So this is, and one more case I will share with you. Dr. Shweta, this was visible video. So second case now is Arnav Mishra's
Yes,
case.
ma'am, you are visible. Everything is perfect.
Thank you. Thank you. Yeah. So diagnosed case of PhD and apraxia of speech. If he wants something, he will point. If he wants water, he will point. If he wants, he will. So he's not talking, he's just pointing. Ayurvedic medicines taken for 7 months, not a single meaningful word. If he wants something, he will point with a finger. Mostly he will be shouting. Therapy is going on since long time after diagnosis of ADHD. Apraxia of speech. So we have to really understand what these things are. Apraxia of speech is an acquired oral motor speech disorder affecting an individual's ability. And AOS have difficulty connecting speech messages from brain to the mouth. Autism and apraxia clearly have different features. A child with autism who has profound language delays such that he or she is verbal or non-verbal may have undiagnosed childhood apraxia of speech masked by his or her language deficit. The study conducted autism and apraxia are highly comorbid. So this boy is having both the things. So again, we have to go with a procedure. What I want to say A and say I. That way it happens. So mother's history during pregnancy, during 9 months, mother not getting sleep, dreams of God, C-section delivery, baby passes a stool, meconium, appetite, selective food, craving salty, chips, aversion sweets, thirst less, thermals hot, motion doing in diaper, urine clear, 5-year boy, motion doing in a diaper. So after speech is also affected and he is not able to get this sensation. Moving in a sleep, no complaints with perfumes, agarbatti, change of weather affects him, cold, cough, fever. As per father, understands all emotion. He will not take initiative to mix with new people, takes time to mingle with the people, prefers to show things pointing needed rather than telling about it or pronouncing it like this. Water will show, food means he will show, obeys to parents, prefers to sit in a silent room, tries to put fingers on hearing sound like this. So this case was given nitramute, 4 pills. 7 December 2000, he started telling mummy, papa. On 14 2018, same telling one word. So vital force was given, went to native. Usually they are all from all over the different states. So they keep visiting their native place or some job. On 5th 3 2000 came to meet and reported he got admitted in hospital diagnosed with lower respiratory tract infection. So I'm trying to give you again a whole complete picture what exactly happens for a child, change of a weather or change of a place. If they are going, they are taking allopathic medicine, syrup, augmentin, all allopathic medicine is given. This time they say doctor give the same medicine. They are telling to me now. They came to my clinic and they are telling for us whatever earlier you used to give. After that he is saying mummy, papa, daddy at least. So again we have given him medicine, a single dose, considering this phenomena. And for 2 to 3 months, father used to come from office and take medicine. They have visited anywhere, so they were taking medicines, and mostly the vital force is given. They visited my another clinic, and I was at another clinic, so not changed prescription. So mostly nitramur was given. Every time follow up towards papa, cat, dog. So they were just taking a medicine. They were not visiting me. So I advise bring him once. So I have reconsidered and clinical observation turned to that the rubrics again complete case taking was taken and Lachesis 200 was given. Within 1 month, he started speaking a complete sentences. The rubrics were taken from restless, concentration difficult. So the presence of a patient is very important to take the complete rubric. If you are giving the medicine with the parents' perception, the rubrics may be wrong and the may be wrong. So this case, I asked them to bring the child. And then it was given restlessness, concentration difficult, dullness, sluggishness, difficulty of thinking, comprehending, mistakes writing in. And then Lachesis was given after taking this rubric. Every month, father is collecting the medicine, writing improved. As per father, he requires more concentration. Daily, night, parents are making him wear diaper to stop using diaper. This point also need to improve. And now you can see how he improved.
Now is the
Tell me something, Arnav.
Sir,
Tell me some poem.
Sir, hi auntie. Hi auntie.
Say hello.
Hello.
Speech also is good now. Happy overall.
Now.
And he's sitting quietly. Hyperactivity is not.
1 to 10. 1 to 10.
100.
ABCD.
A for B for 1 word. Yes.
ABCD. A. Tell A. What is written here?
So this is how the things, the boy, they are not able to speak, and the basic demand of a patient are they should speak, they should talk. What are the things they should able? This boy who is pointing the food already mentioned, now he is able, and you can see the happiness of parents, how happy they are. The boy is able to talk, and every time he will carry his books and all, and hyperactivity is also reduced down. So this is the second case. And now the third case, Samarth 6-year-old patient with autism, treated well for a speech delay, absolutely doing good with allopathy, homeopathy, and speech therapy. This case is these parents are giving him everything along allopathy, homeopathy, and speech therapy. And he they went for one school for admission. So this boy answered everything. whatever question they asked, so he got a admission to the normal school, not to the special school. So and parents were really very happy. But now what has happened? Admission he got, he's improving everything. But this boy has become destructive, reported with pushing, pulling, destructive here in bus, in school bus and all. He started doing some beating and all. This time parents don't want to start any allopathic tablets. First time when they came, the complete case taking everything, but they were taking. But this time, ma'am, now no speech therapy, no allopathy, only homeopathy. Then this case episode improved with a single dose of tuberculinum, and whenever that destructive behavior, I gave SOS Hina 200. So like this, the patient really improved. Autism and homeopathy, they are giving the best and best result, giving good hopes. Whenever the speech therapy is not giving you any answer, take cases confidently. If they are asking, want to do speech therapy, you say just wait for 1 month and then you see. One more case I remember, that boy was a normal boy, but mother was having a psychiatric disorder. So parents used to go to office, and the boy and the nani, the grandmother, used to not communicate with each other. So that boy was not talking. So we have to differentiate here. We really need to understand what is the problem, what is the diagnosis. Why? Just to, we should not make that child a special child or any autism child. What is abnormal? In pediatric, it is very, very important. So thanks a lot to each and every one, especially the participants, all the participants. I know today is a big day. Our Prime Minister Narendra Modi ji 3.0, he is taking over. Our seminar is going on and you all are here. I'm very thankful to Dr. Kavita Kutnoor ma'am, Dr. Shweta Singh, all my family team. Everyone, thanks Dr. Rathod for be with us with the Ka family. Thank you each and everyone. Over to you, Dr. Shweta. Yeah.
Thank you, Dr. Deepa, for such an insightful session. And we have with us Dr. Niharika Sapra. Do we have any questions in the chat box?
No, ma'am, no questions.
No questions?
No questions.
Okay. Anybody would like to ask any query from our respected speakers? You can write us in the chat box. We will raise those questions to the speakers. So there are no questions, and
I have so many questions over there. Someone has asked me about the zinc. Question is, doctors have been selected zinc metallicum. Someone is asking why only shamelessness, how shamelessness is wrinkled. You decided. See, I have not decided anything right now. Before to start our webinar, I already spoke about that. You should be an unprejudiced observer. So whatever the patient is focusing you, whatever the patient is giving the symptoms, shamelessness is not a symptom. It has been observation from my side. Wrinkledness on the forehead is also the observation from my side. So on that basis, you can select the that rubric. You can select only few rubrics. You can select the medicine on the one rubric also. There is a, we can consider as a peculiarness of the patient. As we in shamelessness, there are so many medicines comes under the shamelessness. So I have not selected. This is all the observation. When see, if the patient is sitting in front of you, who is having the long neck, there are only few medicines for the long neck. There is we can consider the emaciation of the cervical region. On that basis, also you can select the medicine. So if there are 20 medicines come up in the repertorization, so you have to differentiate all these medicines. If, what we consider as an we differentiate the vegetable kingdom, mineral kingdoms, and animal kingdom. And the patient, depending on the personality, constitution, I used to elaborate the patient. I used to differentiate the patient. If the patient is belongs to the vegetable kingdom, I used to see the what is the exactly sensation of the patient. See, there is a zincum metallicum has been prescribed by some. Zincum metallicum is this is a mineral kingdom. Okay, zincum metallicum is belongs to the fourth row of the periodic table. It's a fourth row. There is a so before to enter on this row, third row, fourth row, fifth row, you need some what is the exactness of the situation of the life. On that basis, on the personality, you have to choose the periodic table, you have to choose the vegetable kingdom, you have to choose the animal kingdom. How the present patient having the sensitivity. On that basis, you have to select the kingdoms of the patient, kingdoms of the remedies.
Thank you, sir. In your slides also, you have explained this thing. We all noticed. So there is a question for Dr. Deepa ma'am that ma'am, please elaborate a little on vital force 200C indication.
See, vital force is not a medicine, placebo, but I am giving, see, when I am writing on my case sheet, if someone is seeing like placebo or ABCD, vital force sounds good. Like what medicine, like, see, Bangalore, very intellectual. Ma'am, what you have given, show us what you are writing. So we have to be very friendly with the parents and see, this is, oh, you have given, oh, some pills. So it is just a plain pills. They are just a placebo. Vital force is no medicine, nothing. Yeah.
Yes, ma'am. And there is this question that in case of autism, what rubrics you have taken?
See, it depends on the case. We can't say like what the things are coming to us. Common, it's we can't make it these rubrics or as Rathod sir, uniqueness on observation. We can't be biased. We have to be really unprejudiced observer. If we fix our mind, we started seeing that way. This is we will see every child then hyperactive, destructive. Every child we will see from that point of view. But yes, we can destructiveness, hyperactiveness is there, speech delay, irritability is there, milk intolerance is there. For research purpose it is good, but when it comes to the clinical practice, we really need to be the unprejudiced. I think
Yes.
that answers. Yeah.
Yes. And ma'am, there is this question that SINA, what basis it was given?
So see, Sina is so irritable. Like in materia medica, if we grow, it is very irritable, 3+ irritable, cross. And he will push away the child. Like in bus, he is pushing. In the school bus, the fighting started in a school bus. Maybe the who have started fighting, we don't know. But the push kind of destructive behavior is seen in the Sina. Throws the things like he will just aiming that it will go to that boy or that will with this kind of thing the Sina is given. Another is chamomilla, but mostly they behavior in during the dentition, that kind of irritability, that kind of cross behavior. Even as soon as the patient entered and all, we observe so that that irritability, he is not beating to that boy but to mother also, to father also, the destructiveness in complete materia medica, that any child like बहुत बदमाश है, बहुत शैतान है, कहाँ से ये शैतान आ गया, like very he, this boy is very highly irritable, पता नहीं क्या ये बच्चा है. You give single dose of a Sina and see how the improvement happens. If the behavior is during dentition, think of chamomilla and Sina. So on that basis, Sina was given and that helped. Intercurrent tuberculinum was also given. Yes.
Thank you, ma'am. Dr. Ashok is requesting you, ma'am, to please give few more words about the last case. destruction of face and remedy if you
Actually, thus I just wanted to present as that case, the complete two case I elaborated, and the last one was as they were the parents were taking everything, allopathy, homeopathy, and speech therapy. When they came to me, they were not taking only homeopathy, but these two cases they were purely taking homeopathy. No speech therapy was also there. Not only on any, they have stopped everything. They are just taking my medicines. So destructiveness and behavior, the main aim for parents was he should get admission to the good school, and their purpose was solved, their purpose was resolved. So and then that boy, I think nitramure was started for him. I don't remember the long back it was. Now the boy is doing good with Sina, and nothing now, even homeo also they have stopped. The boy is really doing well. He's scoring good marks. Yeah.
Thank you, ma'am. I guess there
Yes.
are no more questions. We can proceed forward. And
Dr.
the
Ravi
jot form for
Hirani,
the
Ravi Hirani, sir, please come up. Jyoti ma'am, Ravi Hirani ji hai kya? Please come up. We are very thankful, Ravi ji, for you for referring Dr. Vinayak Rathod, sir, for the Ka family as a speaker. Yeah, sir, camera on कर सकते हैं रवि जी. So Dr. Ravi Hirani suggested, okay, he's saying thank you to you and Dr. Kavita ma'am. Okay, thank you, sir. Thank you. Yeah.
Thank you, Dr. Deepa, and thank you, Niharika, for taking up all the questions. And I would like to thank Dr. Vinayak Rathod and Dr. Deepa for such an enlightening session. It was really interactive and wonderful, and it was worth listening. And we would like to take the privilege to honor our speakers with Ka Appreciation Certificate. Please accept it from Ka Homeopathy Study Group. Congratulations, Dr. Vinayak.
Thank you. Thank you so much.
Welcome, sir. Congratulations, Dr. Deepa.
Yeah. Thanks.
Thanks to both of you for your gracious presence and for your precious time in sharing your knowledge and wisdom. And with your permission, let me announce the upcoming July webinar, that is on 9th July 2024 at 8:30 p.m. IST and 10 a.m. EST, US and Canada. We will have Dr. Kritik Shah. He will enlighten us on Dr. Ken's 12 observations supported with successful clinical case studies. And you can find the link to register at our website, kavitakehomeo.com. Don't miss the webinars. And thank you to our honorable speakers. Heartful thanks to our viewers and followers to join us today. We will have such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. And for the upcoming webinar info or any other updates, follow our social media handles, that is on Twitter, Instagram, Facebook, LinkedIn, etc. If you missed any of the webinar, you can watch it out at our YouTube channel with the name Kavita Kuknur. And I'm thankful to Ka volunteers for their continuous support and selfless services with which we are able to organize these webinars in successful manner. For any other info, please reach us at kastudygroup@gmail.com. And please don't forget to fill the jot form to receive your participation certificate. Thank you all for joining. Have a good day or good night.
Thank you. Thank you so much.
Thank you, sir.
Thank you.
Thank you.
Great day. Bye-bye.
Thank you. Thank you.
Bye-bye.
Bye.
Goodbye to all. Bye.